We talked last time about ethical dilemmas and how to discuss those. The point being that that's something you'll almost certainly have to do when you get to the interview stage in your medicine or dentistry application. So I thought we'd kind of continue that interview preparation theme, and this time look at this question: what does it actually take to be good at medicine or at dentistry? Because you're going to need to show that you've thought about that problem, and having identified the sort of attributes that you're going to need, you need to show some confidence that you personally are going to be able to develop them. So, first of all, you're going to need to be able to describe your motivation for wanting to follow these careers. Traditionally, they used to just ask you that question straight out, why do you want to be a doctor? Why do you want to be a dentist? They don't do that quite so much these days, although you still need to be ready for it in case they do. But I think they don't do it because they know that all they'll get for that is a sort of pre-rehearsed speech, and that's not really what they're interested in. What they want to know is how good you are at sort of conversation, at talking to people in a natural way, and so it's going to come up in passing, really, in the context of talking about other things. Even so, you need to be sure that you can explain your motivation, and you can't just say things like, I've always wanted to be a doctor. That may be true, um, but their take on that would be, well, okay, so you made this decision when you were 7 years old. That's not going to be a very well informed decision, really. If you haven't re-examined it recently, then that's a problem. So you need to sort of have a story to tell. You can begin with, I've always wanted to be a doctor, for example, but you then need to talk about things that have happened recently. So experiences that you've had, possibly with your own health or with friends or family, or some incident that you witnessed, all kinds of things that sort of made you pause and think about the reality of it. And you need to be able to explain that you're ready for the real reality of being a dentist or being a doctor, not just for what you kind of may have imagined it would be before you really investigate it. And so think about that. Think about the story you can tell. It doesn't matter if it's a fairly recent decision. You may have always wanted to be something else, and then something happened that made you think, yes, actually being a dentist would be so much better a path for me. And if you can explain why you came to that conclusion, that's absolutely great. Okay, once you've established that motivation, you need to sort of remember that. You need to remember that your theme is, I am hugely motivated to pursue this career. Um, and that sort of commitment needs to shine through as much as it can at interview, because that's one of the things they're really looking for. So even though sometimes you may have to talk about sort of negative things, um, it needs to be very clear that yes, you've thought about those, yes, you're not making light of them, but nevertheless, your motivation is so strong that it doesn't matter. This is where you want to go. Nothing else will do. And yes, you do need to be able to make it clear that you do have a very realistic understanding of the career and all of the bad things, the problems, as well as the good ones. So we'll explore that a little bit in the course of going through this today. So if you're going to have a realistic view, where does this awareness come from? So these are the sort of things that you may have done, which will help you with developing that awareness and which you need therefore to be able to talk about. So you may have um, done some shadowing, meaning actually being there and watching doctors or dentists doing their thing. If you're applying for dentistry, it's pretty important that you try to do that, because a lot of the dental schools actually require it. Not all of them, but some of them certainly require you to have spent some time in a dental practice, watching them do what they do. In medicine, it's not required. So if you haven't been able to organise it, don't worry. You can get the same experience effectively, indirectly, in ways we'll talk about in a minute. But the reason why it's often suggested as a good thing to do is obviously that it very directly gives you a picture of what it's really like doing the job, and so that's what they want. So if you've done it, great. If you've organised it, then make good use of it when you get it, and in particular, use the opportunity to try to talk to not just the doctors but the others around them as well. The others on the medical team, because if all you do is sort of get the chance to watch them, you can learn a lot from that, but you can learn so much more by asking them specific questions. And particularly, as we've said, for example, you need to know about the negatives as well as the positives. So yes, you can talk to them about what they get out of their job, what the good things are. You can talk to them about what they think is important in terms of the attributes you need to do the job well, but you can also talk to them about what the downsides are, what they find stressful, and what they think you ought to think about before committing yourself to this pathway. Okay, so talking to health professionals is important. And I stress not just the doctors. If you get the chance to talk to nurses or dental nurses in a dental surgery, reception staff, anybody, it's useful to talk to them about what it's like to work in that sort of environment, but also actually about what they think of the doctors. Because, opinions can be very mixed, just because doctors and dentists can be very mixed. Some of them are brilliant at relating to their colleagues, but others are not. And if you can find out about the things that colleagues would value in a colleague such as yourself in the future, then that's really useful information. If you get the chance to talk to patients, again, that's really important. That could be during shadowing or during your own volunteering, or just people who've had interactions with doctors and dentists recently. And again, talk to them about what the patient experience is like, but especially see if you can get them to talk about what they thought was good about interactions they had with their doctor or dentist, but also what they thought was maybe not so good. And just see if there are things that you hadn't really thought about, which are actually serious issues when it comes to being a patient. It is also possible to do work experience online. So in other words, to do a virtual work experience when you're not really there. So here are some links. So the top two are provided for people considering applying for medicine. So they're both, more than just a quick video. I mean, but it's not a massive effort. It's a few hours to go through the entire work experience in each case. So the top one is focused mainly in hospital, but not entirely. So there's a bit of GP stuff. The second one focuses specifically on being a GP. And they're both really quite good. They were set up during COVID when people just couldn't get any work experience, but they were very successful, and so they've continued since. And when you go for interview, they won't ask you where did you get your work experience. They're not interested in what you did. They're interested in what you learned from it, and you can learn from it just as effectively from these. The second two are about dentistry. The Sheffield one, you have to be a little bit careful with that because it's a MOOC, and the MOOC provider is quite keen for you to pay some money. But there is a free option, and that's absolutely all you need. Don't worry about certificates and all that kind of nonsense. Nobody's going to be interested in those. So it's just using the free service to go through the resources of the MOOC. So I think these are good, and personally I think it's worth you doing them, some of them, even if you have actually done live work experience, because obviously you're getting a different perspective from these, and also the reality of actually being there doing your own shadowing is that what you get to see depends very much on what happens to be happening that day. So you won't necessarily get a good overview of what life in general is like. You'll sort of just get a snapshot of what life was like on that particular day. Whereas these, of course, have been carefully crafted to try and give you more of an overview. And so they may raise questions that just didn't arise, during a live work experience. And I think they do that very well. So I strongly recommend that you consider doing one or more of these, even if you've done live shadowing as well, and definitely if you haven't had the chance to do any live shadowing. So having had some work experience one way or another, watching the professionals doing what they do, you need to start reflecting on it, to ask yourself questions about it. For example, you need to be clear about what it is appeals to you about the job. And you need to be able to talk in some detail about that, not just sort of vaguely think, that would be a worthy thing to do or a fun thing to do or whatever. It needs to be more sophisticated than that, showing that you've really thought about it. Equally, having thought about what you think you would really get out of it as a positive experience, you need to think about the negatives, and you need to be able to show that you think you could cope with them, to be able to talk about the stress that arises from all sorts of different causes, but say, yeah, I have had to cope with stress, in exams or in life experience in the past, and these are the things that I find works for me, and be able to talk about those. Don't just say, oh, I go out and kick a football around, but be able to explain why that helps with your stress levels. And it is really important that you identify the sort of things that that cause stress, because there are a lot of them. So, in clinical practice, you have to face the fact that you'll get lots of difficult patients who may just be sort of, difficult people, but who may specifically be dissatisfied with what you're able to do for them, and you have to cope with that. You have to cope with your own disappointment when things that you try to do for people just don't work, because they don't always work. You need to talk about the fact that you may have inconvenient hours, which can sort of really interfere with your personal life sometimes. You have to talk about the fact that the colleagues around you can sometimes be difficult. They may not be doing what you think they should be doing, and they may not think that you're doing your job as well as they would like you to, rightly or wrongly. But all of that's quite stressful. And the career structure isn't a straightforward one these days. If you're going to be a hospital doctor, for example, you may not have a permanent job until you're sort of going on 40 or something. And all of these things make life a bit difficult. So I'm not trying to put you off here, because hopefully these are hugely outweighed by all the positives, but they want to know that you've thought about the negatives. And then moving on to the topic that we're mainly going to focus on in the rest of this session, you need to begin to think about what makes the difference between a really good doctor or dentist and one who's not so great. Because identifying those skills is really important, because you obviously then need to really focus on those, and aim to develop those as your career progresses. And so with that in mind, what you also need to do is to relate your understanding of what attributes a doctor or dentist needs to your own strengths and weaknesses, so that you can say, yes, I think this suits me because it plays to one of my strengths, but also be realistic. You can't say that for everything, and it is important to be able to say, well, that's not something that comes so naturally to me, but I'm aware of that. It's something I've worked on. It's something I am working on. It's something that I'm confident I will be able to do. But they want you to be honest about that. If you just kind of claim to be brilliant at everything, they're probably not going to be convinced. So honest self-reflection is a really important part of preparing. It's important to emphasize that unless you apply to Oxford or Cambridge, in which case they're going to be interested in how smart you are because their course is very sort of academic, at least in the early parts of it. Everywhere else, they don't really ask that question in an interview. They take the view that if you're good enough to get your 3 A's at A level, then you're smart enough to cope with a medical or dental course. So they don't ask questions to probe your intelligence. They focus on this question, will you be good at working with people? Because that is hugely important. Obviously, you need to be able to develop an effective working relationship both with the patients that you have to handle, but also with the colleagues around you. And the interview will focus on them trying to get an impression of how good your skills at working with people and talking to people will actually be. My own feeling is that when you are trying to convince them of that you'll be good at these things, you ought to talk as much as you can about actual experiences that you've had, rather than just talking theoretically. It's one thing, to talk, for example, about how it's very important to be good at, communication skills. We'll talk a bit more about that in a minute. But just talking theoretically about that is one thing. But if you can show that you really understand how important that is and how challenging it sometimes can be, because you've sort of seen it for yourself, it's so much more convincing, and it's also so much more interesting for them to listen to if it's not just a sort of standard theoretical account. So this is where you get the chance to talk possibly about your shadowing, but it's the trouble with that is that it tends to be very passive from your point of view. What they really want to hear about is your own experience. So this is where you get to talk about volunteering, about experiences you've had with people if you have a part-time job, about caring for people in your family or amongst your friends, and about teamwork and responsibility that may have come your way in group activities like sports or drama or just within your friendship group. These things are really important. And so over the few months that you've got ahead of you, and you have got quite a lot of time, the earliest you're likely to get an interview would be sort of late November. So you've got plenty of time to think about all of this. But what you need to be doing is kind of building up a repertoire of things that you're ready to talk about, not prepared speeches. Prepared speeches are a disaster in interviews because they just sound false. But just so that when you're asked about a specific thing, your head is prepared for it, so that you think, oh yeah, I could talk about this story, or I could talk about that story in relation to this issue. And so sort of keeping some notes, just going over what can I use from all the experiences I've got that might become useful in an interview is time really well spent over the months ahead. So you can reflect then on those experiences that you've had. So the whole range of what you've been through in the last few years, one way or another. And they're very keen on the idea that it's unlikely that everything you've done sort of brilliantly from the start. That it's much more likely that you had some kind of learning curve where you maybe struggled with something initially, or at least had no idea how to do it well, and then gradually learnt from your own mistakes, from watching other people, from feedback, and just got better at it. And talking about how you managed to do that is a really positive thing, because they will take the view that that's what it's going to be like learning to be a doctor or a dentist. No one is just naturally brilliant at everything. Everyone is going to have things that they find difficult to start with and have to really work on improving. And if you show that that's something you're up for because you've already done it in the context of whatever it is you want to talk about, that will be seen as a hugely positive thing. Okay, so when you're reflecting on your experiences of working with other people, being around other people in whatever context, think about things where you've gone through a learning process and just got better at the interaction over time. You also need to reflect on communication skills. Everyone is going to use that phrase in interviews. You know, a dentist needs really good communication skills to interact effectively with their patients. But most people are not that good at explaining why that's really important or identifying what those communication skills are. And that's what you need to therefore think about so that you'll be ahead of the field in that regard. Okay, so here is a video which provides an example of a doctor with less than outstanding communication skills. So if you just want to pause the slideshow at this point and just watch this video and have a think about the fact that, yes, it's very obvious that she's a bit rubbish at the way she deals with the patients, but see if you can identify specific things she does or doesn't do that contribute to that sort of overall failure. Okay, so if you've then viewed the video, you can see that there are a huge number of problems in the interaction that was there. There was a real lack of sort of engagement with just how bad the patient was feeling. The doctor was constantly trying to sort of chivvy her along, just kind of say, "Oh yeah, it's not really all that bad, you know. I'm sure you'll just get over it. Don't worry about it." And you know, when you're talking to someone suffering from severe depression, that's just completely ineffective. So this way that we're all often tempted to use, which is to just kind of try and say, oh, you know, try and feel more positive about things, you know, and then you'll feel better. It's just not a good way of dealing with people. She didn't let the patient speak. That's really important, that you have to give patients time and space to express what they want to express. And she sort of basically cut her off all the time and just, you know, as soon as she said yes or no, the doctor would say, great, yeah, okay, let's move on. And that's completely ineffective. If you're trying to figure out what the issues are that a patient is really facing, you've got to give them time to express them because they're hard for people to talk about. The doctor didn't really make any attempt to show that she cared, that the patient was the focus of her attention. She allowed herself to appear very distracted. Obviously, that can be a problem in a busy working environment. That there may be interruptions, but you have to work very hard to show the patient that despite all those interruptions, it's the patient that you're really focused on, and the doctor really wasn't doing that. And you know, you can go on and on, but it's a worthwhile exercise for you to just go through and make a list of the things that the doctor could have done better, could have done totally differently in order to interact more effectively with that patient. And I think looking at sort of examples of bad practice like that can often be quite informative, because if you just watch examples of how to do things well, sometimes it isn't very obvious quite why it's working. You know, you just think, oh, that seemed like it was a good interaction, but it's not always all that easy to put your finger on exactly why. So a process of looking at some bad examples like this and identifying, oh, that is what really caused the problem. That was another thing. You're making a list of them, and then you know that's going to arm you with stuff to talk about when you get to interview questions. These are some more videos that I identified, which sort of focus on this issue of how to interact effectively, how to communicate effectively with patients. If you just use Google, you can find loads of these things. A lot of them are aimed directly at people applying for medicine or dentistry, and some of those are quite good and are well worth watching. But I haven't picked out any particularly because they're easy for you to find. And what I thought might be more useful is to pick out some ones which are aimed at people a bit further along in their careers, so people actually in training or even practicing clinicians. And some of those are really quite good at illustrating good and bad points about communication. So I suggest that you have a look at least at some of these, and again go through this process of sort of noting down what's good, what's bad, what's effective, what isn't. And I think it's time well spent. So the second one, for example, has a GP holding a consultation with a child patient and their parent, and they show you two versions. And the bad one is quite obviously bad in some ways, but I felt when I watched that I could pick out a few things, but it was only when I really watched the good one that it made me realize how bad the bad one was, because some of the things that the GP did in the good one, really made a big difference and just were absent in the bad one. So I think things like that are just really good learning tools. So I would strongly recommend these things. The non-verbal communication one is really interesting too, because it's quite excruciating watching a clinician there who's just hopeless at sort of picking up on non-verbal signals, or indeed providing his own non-verbal signals. And again, it's something that most of us are probably not very aware of in ourselves, but learning that's something I need to think about is well worth doing. The last one has some dental focused ones, but honestly, these communication skills issues are not really any different for a doctor compared to a dentist. So I think whichever of those things you're interested in, you can just watch any of these and pick up on some useful stuff. Okay, so another word that crops up everywhere when you're looking at the skills that make a good doctor or dentist is empathy. And it's highly likely that almost everyone is going to sort of bring this word into their interview because everyone knows, oh, it's a really important attribute. But actually, most people don't really understand it all that well and don't really know why it's important or how you should go about showing it. So that's something to really work on. So what empathy means is having the ability to sort of put yourself in the patient's shoes, to really experience for yourself, to an extent, of course, what they're going through, to be able to sort of see the situation as they see it. And you need to appreciate that that's a difficult thing to do. If it's not something you have actually experienced yourself, it can be really quite hard to put yourself in their shoes. And of course, you can't completely do it. If a patient is in complete despair, you can't allow yourself to descend into complete despair. So it's about appreciating their view of what's going on, but not getting swallowed up by it. And so it's quite a difficult thing to talk about, to really explain, but it's worth thinking about. Why is it important? Well, it's important partly because your job as a clinician is in part, to deal with what's physically wrong with your patient, and to come and treat the sort of physical problems that they have. But it's not just that. Patients are, if they're seriously ill or if they've got serious pain from whatever cause it may be, they're likely to be really distressed. They're potentially got great fear associated with the symptoms they're going through. And your job as a clinician is to help them with that fear and distress and pain and worry and doubt and all that kind of stuff, as well as the, the physical stuff that they're going through. And you can only do that if you can understand what those emotions are that the people are experiencing. So that's part of the reason it's important. The other is sort of to do with trust, that the patient is only likely to sort of develop a relationship of trust with you if they think that you really care about them and that you can kind of understand where they're coming from. And trust is important because unless they trust you, they won't really open up about their symptoms. So they won't necessarily give you a full and true account of what they're going through. And they're also much less likely to sort of do what you say. One of the big problems in medicine and dentistry is that, when you've sort of finished doing what you can with a patient in the clinic, you send them away with some advice about what they need to do, whether it's just, following through on the prescription that you give them, or changing their lifestyle, or things to watch out for. And if they don't really listen and take those things on board, they just don't do them. And so the problem is likely to recur. But if they really trust you, if they felt positive about the relationship they'd built up with you, then they're really likely, much more likely to think, yeah, actually, I should really listen to what they say, what the doctor says, or what the dentist says, and act upon it. So empathy is hugely important for those kind of reasons. So again, here's another short video. This is a little bit twee, but it's kind of useful because it explores the difference between empathy and sympathy. So sympathy is just kind of feeling sorry for your patient and wanting to be kind to them, but not really attempting to understand them. And what this video emphasizes is that although it's not that you should have a lack of sympathy, I mean, sympathy is important, but if you let that dominate your interaction, it can actually have a negative outcome. So again, it's just a way of emphasizing why empathy is really important. So again, there are more videos out there which deal, some of them specifically with empathy and some just more generally with effective consultations. And again, I think these are worth watching because they're aimed at people further along in their careers. And so they give you sort of insights which are a little bit different from the ones that you get just by looking at the, how to get into medicine kind of videos, of which there are also many out there on the internet. So the second one, for example, again, I like there because it has alternative versions of a consultation. But this time, the first one they show you actually isn't that bad. And so the second one is really interesting because it's better and it really lets you focus on really important things that make a difference in terms of how well you end up building a relationship with the patient. There's a whole channel. The third one there is a link just to a channel, which is from the University of East Anglia, and just focuses on all sorts of aspects of effective consultation, and it's quite a useful guide just to prompting you to think about things. It's not that you necessarily have to take on board all the things they say, but just having thought about, oh yeah, that's an issue, is a big step forward. And the last one is interesting. It's because this time it's sort of just a patient's perspective. It's someone who's just been to the dentist and sort of had a thoroughly not unsatisfactory experience, and just talking about the problem that arise when the dentist fails to conduct a consultation in an effective, empathic sort of way. So again, those are things that are really worth doing. Teamwork is another thing that you need to reflect on. It's a big theme in the NHS, and therefore it's a big theme in interviews for medicine and dentistry. Because as a doctor or dentist, it's important you understand that you don't work in isolation, that you can only function effectively as part of a team. And partly just because you can't do everything, but also because you won't actually have all the expertise. You're going to rely on other people who can do things that you can't do. And so showing that you can work effectively in a team and that you understand what the challenges are that involves is really actually an important part of convincing them that you're prepared to move on to study to become one of these professionals. Teamwork is quite difficult for doctors and dentists because you tend to sort of have a leadership role within the team. So, it's about taking seriously all your colleagues, accepting that they will know about things, will have seen things, will have understood things that you may not have understood. So you've absolutely got to respect their insights and their input, and their suggestions as to what the best way forward is. But in the end, in a team, there are going to be lots of different views, and someone has to make sure that all of that's brought together into a sort of coherent plan as to, how do we go forward from here? And that will tend to be the doctor or the dentist. So when you're reflecting on teamwork, reflect on leadership as well. How are you an effective leader within that team? And it's about that balance of saying, well, I can't sort of act as being a superior to these people. That's not what leadership is about in this kind of context. But I do have to make sure that everyone works together and that in the end we move forward and we don't just spend all the time sort of disagreeing about things. So teamwork's a difficult skill, and you need to reflect on your own experiences, as we've said. Whether your team is a sports team or a creative team or just a friendship group, you can use experiences from those kind of things to show that you really understand what teamwork's all about. And we've already talked about stress. Okay, so you need to think about why there is a lot of stress associated with being a doctor and with being a dentist, and identify some of the actual causes of that stress. And then, as I say, be able to explain how you personally feel you can deal with stress. So identify the other activities that you have in your life that you find are effective at reducing stress or deflecting your mind from things that are causing stress, and really try and sound convincing about that. Don't just list things you do, but talk about why they help you cope when things get difficult. And also make sure that you emphasize the importance of talking to people, okay, about sharing the stress and not bottling everything up, because that's a really important part of coping with the challenges of the career that you're moving on to. One point I really wanted to make is that the more specific you can be in the examples you give to illustrate these points, the more convincing and the more interesting your answers tend to be. So, if we think about an example of something that often comes up in discussions, which is sort of like, old people in hospitals often can get very lonely because they're away from their home and they don't have people to talk to, and that can be quite negative just for their state of mind and therefore potentially for their condition in general. So it's a good idea to talk to them. Okay, that's great. Everybody will accept that. Yeah, that's a valid observation. But you could make that point in a much more interesting and compelling way if you've actually done that and been the person that talked to them and could talk about a particular person and what a difference it made to them, and what you talked about and why it helped them to talk about it, and that kind of thing. And it makes such a huge difference to the way people are going to receive your discussion, I think, because you have to, talking about empathy here, if you empathize with the interviewer, they're going to be asking the same question to 57 people or whatever on the interview day, and there's a massive risk of them sort of internally thinking, oh, it's all that usual nonsense again. And you don't want them to be thinking that about what you're saying. So the way you grab their attention is to talk about a particular person. And it's just so much more interesting to listen to then, but also it's clear to them that you're talking about something you've really experienced yourself and have understood. It's not just something you've read off some website. So really, really important message from this session today is to try to build up a repertoire of specific little stories that you can draw upon in interviews. So think about stuff that happens when things happen to you in life, in your volunteering, in your job, whatever. Make a note of them, because you might think at the time, oh yeah, I'll remember that, 6 months down the line, but you might not. So start keeping a sort of little database of things that you can talk about. And as I say, don't rehearse stories, because rehearsed stuff is always bad, but just think, oh yeah, I know that would be an interesting thing to talk about, and just have a sort of checklist of points that you'd want to make. I think that can make a massive difference to how well prepared you are for having a good interview experience. So as you talk, your interviewer will be assessing you for lots of different things, but as I say, it's all these soft skills, these kind of human interaction qualities that they're looking for. So your enthusiasm and commitment needs to shine through. And sometimes people think it does when it actually doesn't. In other words, when you're just talking yourself, it's difficult to know quite what effect that has on other people. So you may think, oh yeah, I'm talking about how I'm absolutely clear this is what I want to do with the rest of my life. And it's possible that the person listening to you will think, oh, they don't sound very sure about that, or it doesn't sound like they thought very hard about that. And obviously that would be bad. So you need to get feedback. So in other words, you need to practice talking to people and see what impact it has on them, what impression they get of, for example, your enthusiasm and commitment. So over the coming months, you need to just practice talking with people, and try to get some honest feedback for them about the impression that you're giving. Self-awareness is hugely important. Okay, they want to know that you're aware of what your strengths are, but also of what your weaknesses are. That you know that no one is brilliant at everything, and identifying what your weaknesses are, what the things are that don't come all that naturally to you, is a really positive thing. Sometimes people sort of think, oh, I can't talk about weaknesses because then I'll come across as being a less good candidate than someone who's brilliant at everything. But that's really not true. Okay? They're not going to believe that anyone is brilliant at everything. So if you can't talk about weaknesses, that will be a sort of black mark against you. So self-awareness is really important. And again, it's useful. It can be awkward, but useful to talk about that with other people and get other people's impression of what you're good at and what you're not good at, because it may just be something you hadn't thought about. But becoming aware of it could be a big step forward. So self-awareness really matters. We've already talked about the learning curve thing. Okay, but if you can demonstrate just from the way you talk about things in your interview that you're the kind of person who accepts that sometimes things happen which you don't do all that well, and that you learn from them, and you think, oh yeah, I could have done that better. This is what I'll do next time. And showing that that's how you operate is a really good thing, because that's what it's going to be like in the training that you're going to be moving on to. And awareness of the contribution of others. Obviously, you're going to be focusing largely on yourself in these discussions, because that's what they're going to be asking you about. But if you can bring in mentions of how important the contributions of the other people around you were in a given situation, then again that speaks to the fact that you're likely to be a good team player, which is really important. So with self-awareness in mind, you need to start asking yourself serious questions about yourself, and just thinking about how you would discuss those things in an interview situation. So strengths and weaknesses, as I say, go through all the experience you've had and think about what that says about you, what you're good at, what you're not good at. And what you're not good at isn't a problem, so long as you can say, well, having identified that that's an issue, it's something I've worked on, learned to get better at, feel confident that I will be really good at by the time it really matters. And that positive attitude to improvement is something they're really going to be looking for. You need to think about what you've learned through your experience. Again, it's a question that I was quite often asked explicitly at interviews. Tell me about what you've learned through whatever volunteering you've done, or what you've learned from your experience in a part-time job. And they're not asking about technical things you've learned. They're asking about what you've learned about effective communication, what you've learned about empathy, but perhaps more than anything, what you've learned about yourself. Because it's only when you're faced with these challenging situations sometimes that you really learn these things. So see if you can, again, think about that in advance. Make a few notes about it and think, oh yeah, that's something I'd like to talk about at interview. Because it's really hard, if you haven't thought about it in advance, to sort of focus on it, identify the issues, think about what it all really means on the spot like that, especially when you're under stress in an interview. You need to have thought about it in advance so that you're ready to talk about it. It's worth thinking about things that haven't gone as well, in your life one way or another, and particularly if you think, well, that was to an extent my fault, and think about these mistakes and what you did about them. Did you recover from it well and do the right thing about it, or did you not? And therefore, what have you learned from that about how to handle these kind of things in the future? So again, sometimes they will ask you very nasty, direct questions like that. Tell me about a bad mistake you made and what you did about it. And again, it's quite hard to think, what on earth do I talk about if you just get that question out of the blue. So make sure you've thought about those kind of things in advance so that you know what you'll talk about. But don't prepare a speech, otherwise it won't sound honest. It needs to sound like you're honestly reflecting on it in an interview situation. But knowing what you're going to talk about will let you do that much more fluently and confidently, and that's what's going to make the difference. It's quite important to think about how other people see you, and not just sort of how you see yourself. Someone in an interview last year was asked, how would someone who doesn't like you describe you? Which I thought was an interesting and really, quite challenging question to get asked in that kind of context. But again, it's a really interesting question to explore. And so it's worth thinking about, because it's just a different perspective on your personality and the way you interact with people, and recognizing that some of the things you do, even if they're positive in some ways, might also annoy people. And awareness of that means that you can sort of watch out for how people are responding to you, and maybe adapt your behavior appropriately and things like that. So that self-awareness depends on, I suppose, empathizing with other people, really understanding how they see you, um, as well as how you see yourself. So that's quite an interesting thing. And you can, of course, again, ask other people, although, you know, whether you get a straight answer depends on who the other people are, but that can be a worthwhile process. And above all, what you're going to need to do is to practice talking to people, because that's what the interview is more than anything else. I think that the people who get lots of offers at the end of the day, it's not so much the people that have the best insights into ethical problems, or even necessarily the people who have the most interesting stories to tell about their life experiences. It's the people who are just good at chatting, good at talking about things, because that's what they're looking for, is people who are going to build up an effective relationship with their patients and with their colleagues because of the way they talk to them. So you need to just practice talking to a wide range of people, and that will really contribute to how well you do at interviews. So try and take whatever opportunities you can to talk to as wide a range of people as you can. And nearer the time, you can practice that with specific, interview experience in mind. So it is worth having sort of practice interviews with people, and sort of, explaining to them why you want to talk about specific things, because it's something that you're preparing for. But at this point, it's probably a bit early for that, and it's more just about developing that confidence in conversation and getting feedback from people about, how they think you come across. Because what you're going to have to do in when you get to the interview stage is essentially to talk your way into dental school or into medical school. And for some people, they're lucky enough that that will probably just come naturally. But for most of us, that's something that you're really going to have to work on. Okay, so we'll leave it there for this week.